You're listening to
CRST,
the podcast
from Bryn Mawr Communications.
So, hello and welcome to another episode of CRST, the podcast. I'm Dr. Richard Lindstrom, your host for today's episode, focused on physician entrepreneurship in ophthalmology. I've been in the field now for 50 years, and my first opportunity to be an entrepreneur was actually 45 years ago. And as a pioneer in the field, I've had the privilege of witnessing firsthand how innovation has transformed patient care and propelled our field forward. Today, we're exploring the entrepreneurial mindsets and journeys of remarkable surgeons who are not only working to improve patient outcomes, but also to push the boundaries of our industry. Together, we'll gain insights into the challenges and rewards of creating new companies and developing groundbreaking technologies. Let's meet our guests, Dr. Ashley Brissett, Dr. Rania Habash, and Dr. John Hovannisian. Thank you all for being here. Let's begin with some self-introductions. Dr. Brissett, and then Rania and John, why don't you tell us a little bit about yourselves and where you practice and how you got involved in entrepreneurship.
Awesome. Thank you so much for having me. So I'm Ashley Brissett. I'm a cornea cataract refractive specialist here in New York City at Weill Cornell Medicine, New York Presbyterian Hospital. And I kind of got into entrepreneurship. I started a company about a year ago called Daily Practice Eye Care. And I want to create skincare products for the eye area and make everybody taking care of their eyes as a part of their daily practice and a way that they can perform their self-care and help their vision.
Hi, I'm Rania Habash. I'm here in Miami, cataract refractive surgeon at Bascom Palmer. Started a couple of companies, actually three, all because of my background, and they all serve different purposes. One is a telehealth company, another one's a digital health company, and the third is a metaverse company.
I'm John Hovannisian. I'm in practice in Southern California. I do cataract surgery, cornea, refractive surgery as well. I also teach at UCLA and have been interested in the eye care industry for many years, but about 10 years ago, started a company called MD Backline and recently exited that just about a year ago now.
So it's been my belief that the physician actually is in a position in a busy clinical practice to recognize the unmet needs. They're struggling with them every day, and certainly nothing wrong with just being a busy clinician, but sometimes people want to take the next step and either work with an industry to develop a next generation technology or even to develop an individual company themselves. So why don't each of you tell us, why you were attracted to being an entrepreneur rather than just staying as a busy clinician? So let's start with you, Rania.
Okay. I don't know how many people know this or not, but I grew up in very rural West Virginia. My parents were immigrants from Beirut, and they got off the plane and we're in rural West Virginia. My dad was the town doctor, basically, for 40 years there. And anyway, so when I was growing up, what I saw was his patients who had very poor access to healthcare. Patients there, where we grew up, a lot of people don't have cars even. It's really hard to get to the doctor. They need government assistance, travel vouchers, etc., food stamps, everything. And so I just always had that with me. And the first chance I got, I wanted to change that paradigm and give patients access to care, for basic needs. And when the smartphone came out, of course, everyone had a smartphone, but they didn't have a car. And so, even though they didn't have a car. And so I created a telehealth company called HippoChat. And HippoChat was real simple. I designed it to look and feel exactly like iMessage and FaceTime, like we talk to our friends and family, except now they could use it to talk to their doctors. And it revolutionized care all through the area, and then made its way out of state and across the U.S. in different health systems until it was finally acquired. And I was hired on as the chief medical officer during that acquisition, where I worked for like 8 years as the chief medical officer. We went public after that, and then I helped implement my own technology in like 1,500 different health systems, which is the most awesome feeling you can imagine. And probably something John and Ashley both would really appreciate as well. Anyway, just to answer your question, that was the first company. And then it gets almost addictive from there because you just realize that you're in this like really unique position where you can affect change for not just your own workflows and your own needs, but more importantly for your patients' needs and your colleagues' needs.
Yeah, so I often have fellows that have an idea. Ideas are easy, they see an unmet need and they have an idea, and then I always say, well, what are you going to do about it? Are you going to do something about it or not? And John, you saw an unmet need in patient education, and you decided to do something about it. What prompted you to do that?
When you practice, you observe all kinds of things, right? You go from training to the real world. And one thing that I noticed in my early practice days was that reps would come in and ask us questions that we couldn't answer. They'd ask, hey, I sell an allergy eye drop. How does my product compare to the competitors? And I always scratched my head and I thought, I know they're asking this question really because they wanted to strike up a conversation about their product, but do they think I really know how their allergy drop compares to others? We prescribe drops for allergies all the time, but unless you ask patients, you don't know how the different drops work. And it occurred to me that there's a whole element of outcomes in medicine that depend upon patients' reports, not what we could measure with intraocular pressure or other methods. And so out of that was born the idea to have a routine follow up when prescriptions are written, when treatments are recommended to patients. Part of that is to collect information from the patient, but also to educate them as well. Because when we prescribe that drop, we don't always have all the time in the world to educate them on how it's expected to work and what side effects they might have. And so out of that need was born the idea to create software that would follow up with patients after they were seen in the office, and of course it expanded to do other things. But that was really the impetus for it, a need that we had these billion-dollar industries like allergy drops that we didn't have a good way to find out how the products did. And of course, today's equivalent of that is the premium lens implant, right? We know that uh, we think in terms of diopters and lines of visual acuity, but what's really important is how do patients feel about their outcome when they have surgery? And this is such an important industry for everyone that it deserves. The patient deserves a voice in it, and that's part of what we did.
Ashley, how about you?
Yeah, it's interesting what you said about, having seeing an unmet need. My story is a little bit different. As a young female surgeon, especially in a city like New York City, often people would ask me, well, what skincare products should I be using in and around my eyes? Or what would you recommend that I use cosmetically? And so I kind of had an interest in it. And I thought, there's so many dermatologists that create lines for skincare, but there's no ophthalmologist that's really done the same thing. And I always jokingly say, I kind of want to make eye care sexy. So I was like, if we could get eye care products that we know are science backed, that we know is going to be good for people's eyes, for them to be using, that they want to use, and then make it in kind of a cosmetic way where it looks beautiful with all their other beauty products that they have on their counter, we could really win. And I think that messaging really stood out to my patients. So I could say, scientifically, I know that these ingredients are great for use in the eye area. And cosmetically, I wanted to create something that they felt comfortable having on display in their medicine cabinets or kind of with their other beauty products. And so that's kind of why I started my company. And so I want to revolutionize the products, one, ingredients that we're using in and around the eye area, making sure that it's safe. And then two, getting people interested in thinking about taking care of their eyes and taking care of their vision, just like they take care of the rest of their body.
So I was a resident and cornea fellow in a very busy corneal University of Minnesota, and I was going out in the middle of the night and harvesting corneas in the morgue, and then calling in patients on an emergency list. And the highway patrol was trying to, get the patients down in time before the cornea failed. And I saw an unmet need to find a way to extend the time that we had to get a donor cornea together with a patient. So working with the Minnesota Lions Eye Bank, I developed a corneal preservation solution. And but that's just the beginning. And so you have this idea, and then you do some research or some work and you jot it down. But what's some of the things that you need to think about and in the proper order, like including protecting the idea, and then sort of moving into how do you get started in a little financing? Are you going to go to industry with your idea, or are you going to try to build a new company? Each of you have done everything, but what about is it important to protect the idea before you start talking about it and sharing it with others? So, Rhonda, you want to talk about that a little bit?
Yeah, sure. Well, I mean, my personal theory is it's so hard to start a company and actually get a product out of it that is being used that I don't really care that much about protecting. Plus, if someone can do it better and faster than I can, more power to them. That's fine with me. So, I mean, it is important to have IP, of course, but I don't get hung up on that before I start developing stuff. With HippoChat, for instance, and actually with the digital health company Lifelong Vision, and then with MetaMed, it's just all about getting an MVP out, a minimally viable product out first, and then iterating from there. But I'm just kind of laughing a little bit because with HIPAA it was a perfect example. I mean, I knew nothing about the regulatory and compliance laws behind HIPAA, and all the protections and all the stuff, all the compliance laws, basically. But I do remember saying in a very cocky way over and over again, it ain't eye surgery. It can't possibly be harder than learning eye surgery and doing it. So, like, nothing phases me. I'm not afraid to try because we're eye surgeons here. Like, I'm pretty sure if we can do that, then we got to be able to pull off anything else. Um, but look, I mean, that's just kind of my personal philosophy is just do it, just get started, and then you just build momentum from there. I'm just, again, I'm not one of these people who just cares about protecting and hoarding my ideas or whatever, just because I do feel like it should be a race to the finish line, and whoever does the best job of it, great, more power to them, because those ideas that all four of us have had needed to be out there, and we can't impede other people's progress, for our own interests.
Well, the first thing I did was trundle off to the University of Minnesota Technology Transfer office, and which is what you do as an academician. And they thought it was important to register the idea and to get some IP around it. And so they thought that was a first step before
Yep,
trying to go out and raise some
they
angel
always
capital.
do.
What about you, Ashley or John? Did you do anything with IP or registration of your idea?
I didn't, just because, within the industry that I'm in and kind of the skincare cosmetics, that's more difficult to do. My formula for the eye cleanser, which is my first product that I created, is an original formula. So I do own that formula itself. And that was really important to me in working with the chemist at the skincare lab, was that was protected, because again, I had the science background of knowing exactly what ingredients I wanted included in it. And then it was really about the creation of it. I will say, even just starting this, I remember, speaking to somebody and they were asking to see my deck. And I said, what's a deck? Like, I didn't even know where to start. And so reading some books on entrepreneurship, listening to many, many podcasts about how to get started in this industry was important. I think about when we go into our residency training and we learn how to do something like eye surgery, as Rania was mentioning, we train to be able to do that and to offer that service to our patients. And so me thinking I could just, start up a company without any kind of training or background was a little naive. And so really doing that personal education, I think, is an important component of it as well.
John, what are your thoughts on depends on the field a little bit, what protecting ideas? So
Yeah, well, that's right. A chemical formula is a lot easier to patent than a software idea because software is notoriously difficult, and the best thing you can do in general is to move as quickly as you can to have a product and outpace the quote competition. But I think along the way, as you're developing that minimally viable product, it's vitally important to get some advice, and you advice from people first that you trust. You can file a provisional patent with really no almost very little effort and cost, and that gives you a of protecting really almost any idea. And then you can sign a non-disclosure if you like, if the people you're talking to you're concerned. For me, I people like you, Dick, who I trusted, and I got great advice. It's important to talk to people who are going to be. Well, my mother used to say that take somebody who really loves you to tell you that your breath stinks. Uh,
I give you truthful advice. So certainly helps to have a mentor, no doubt. So it takes to develop something from an idea to reality. It takes both human capital and financial capital. One of the first things that I think about is that something's going to have to give, right? So if you're going to to become an entrepreneur, whether it's to license the idea to industry or to try to, especially if you're going to build your own company, it takes a meaningful amount of time, and maybe you need to think about talking to your family about whether you want to do that, talking to your partners about whether you want to do that. So how did that go for you, Ashley? Did you have to decide to work a little bit less, or did you do it on nights and weekends, or?
Yeah, definitely nights and weekends, and a little bit of kind of like a COVID time passion project as well. I think it's really difficult to try and cut back on your clinical work early on when your idea is so early in its progress. I think the further along you get, the more you can kind of see where your efforts are needed. One thing that became so evident to me was to start to learn to trust people that had expertise in areas where I was lacking. So those were things like as starting to think about doing graphic design for, say, the packaging, the website build for our website where you can purchase the products online. And so being able to find the right people to build your team, I think is really important. Learning to trust them and then learning from maybe mistakes you've made in the past and just pivoting and not trying to kind of repeat the same mistakes or do the same thing over and over again.
Yeah, choose wisely when you build your team, and you're definitely going to need a team. So Rania, did you have to give something up at home or at work to do what you've done as an entrepreneur, or were you able to just work more hours? So
So I did the whole nights and weekends thing for sure. Something has to give sometimes, and to me, so I don't have kids, and so I always just kind of wanted to leave a legacy, and that was another thing that was always kind of top of mind for me. Like this will be my legacy.
but it's going to take some time, and it's going to take time and team, right? So what about your thoughts on that, John? Putting together, having the time, you had to go home and talk to your wife about it. I know that, and you're going to invest some of your own money in it, which we'll talk about in a minute, and put together a team. So what was your experience there?
One of the best bits of advice I received, thankfully, I received at the very beginning, which was from you, Dick. And you said, sounds like a good idea. It's meeting an unmet need. The one, I can't tell you whether you're going to succeed, but I can tell you it's going to take a lot more effort than you expect. And so just know that going in, it will take a lot of time, and you'll have to make sacrifices somewhere in your life to make it happen.
Yep. And if you have a significant other or family or children, you need to sometimes include them. At first the human capital comes from yourself, and then perhaps a few mentors. But then what about the early financial support? So in my case, I funded it myself initially, and then found a partner that I shared the ownership in the company with, and moved along from there. But how did you capitalize your idea, Ashley? Did you do it yourself, or have family support, or how did you do it?
Yeah, similar to you. So self-funded to start, you kind of have to believe in yourself and pony up to show that have that ambition and that drive. And I think having a little skin in the game helps other investors understand how important this is to you. And then similar to you, I've then brought on a capital partner who believed in the vision and came on very early. And then we're just closing actually a seed fundraising round. We're almost fully closed to expand the product offering. And I think kind of showing that initial momentum that you could get going on your small budget, showing how fiscally responsible you can be with the company and with the finances over your initial launch, I think is a really important thing to show potential investors in the future.
Rania, how about you? Were you a self-capitalizer, or did you have some family support or friends and family, or?
Self, all self. For Yeah, for 2 out of the 3. The third one was a lot bigger, and required more, investors, but yeah, I mean, I think what Ashley said was just absolutely perfect. Like, I think it's so important that you have to believe in yourself, and the investors, if you're eventually going to them, need to know that you have skin in the game and you believe in yourself enough to invest as well. And then before you ask anyone else, you should be willing to do it yourself first. And then I also think it is kind of important because what I have seen go wrong in a lot of companies that I've mentored as well is that they have these big ideas, and people tell them they need millions and millions of dollars to do it. They'll never get that amount without raising it, and then the idea never comes to fruition. So I think one of the important things is to start with with a size, or with a concept that you can keep kind of small and collected, so that you can self-fund it and it doesn't get out of control too fast, and then just build and iterate as you go.
So, John, how did you fund your company? So,
Well, in the end, it was bootstrapped, and I actually really created another company that was able to capitalize it, a research company that did a whole separate line of work that allowed me to capitalize it. But it's worth saying that the hardest thing, I think, is raising money for an entrepreneurial effort, because it really exposes all your shortcomings as a company. And even more importantly, it saddles you with the responsibility to those investors. And that's particularly poignant if those investors are not professionals, but your friends and family. And I think I feared failing more because I didn't want to fail people who had invested who were friends. Um, More than any other motivator was that I cannot let these folks down. And other entrepreneurs, I know Rania and Ashley feel this way too, just because you have that responsibility. Their hard-earned money was entrusted to you, and so you got to succeed.
yeah, it's a fact that the first round of capital is typically what I call friends and family, and it's Ronnie. Your point is really well taken. That don't be too, have a reasonable expectation, and potentially not atypically, you need to raise 500,000 to $1 million. So it takes some money to get past that friends and family round, when maybe you have some proof of concept and you can go and find a professional investor. But at the beginning, you have to put some skin in the game, exactly like Ashley
Yeah.
said.
One piece of advice I remember hearing, I think it was a business podcast, and someone was mentioning, have the mentality that you just need to get 100 no's before you get your yes, so that all those no's you're not upset about. Just know that that's part of the process of what's happening. And if somebody told you chase the no's, then you're just going to keep asking, keep putting your neck out there, and eventually you will get a yes.
So, what are the absolutely critical team members? Of course, we need a quality attorney and the like. But did each of you create a small board that you surrounded yourself with, or did you kind of wing it yourself, or you have somebody who's a regulatory expert? Ashley, you talked about you know educating yourself through podcasts and books, but a few critical advisors. Who would you think are the critical advisors that everyone should have? So,
Yeah, that's a good question. I think it's probably important. One, you make sure you want to have legal protection for yourself, for the company. So I agree with you. That's important to have. Another thing as well is having somebody that can help on the financial side if that's not one of your strong suits. So, my partner's in the financial industry, and he's been really essential for helping me create different financial models. And so bringing someone on like that maybe has a little bit more experience in areas where you're a little weaker, was really important to me. I kind of had, I think, the creative vision and kind of, the aesthetic side of what I wanted to create, and then having somebody help me execute that. So, then meeting with the chemist and saying, this is what I want the formula to be. Can you make this a thing? Was important. So again, it's kind of independent, I think, to what your company is, and seeking out areas where you are more weak to have people kind of assist in those areas.
how about Rania? What did you surround yourself with as far as expertise?
Two things: a business person, like Ashley said. I think that's probably the one of the most important things, because as doctors, we don't really learn how to build revenue models and projections and all this other stuff that you need to know. And so it is nice to lean on somebody who is experienced and who you can trust. Most importantly, the second thing is software people. And to me, I found out very early on, like, why reinvent the wheel? There are companies out there who everyone trusts to develop stuff, like Microsoft, Apple, Google, whomever, and they all have services and can counsel you and help you build your product. And so, for me, like a program like Microsoft for Startups, who, by the way, supported also at Ascaris last week, is important for developing companies, because they do provide these mentoring services and give you some of the technical expertise that we all need.
John, who did you thought was critically valuable as you built your company?
You mean besides you? So you were very helpful, and I had just one other board member who assisted us, who is somebody who's different, not an ophthalmologist, not a medical person even. And this is kind of to Ranya's point. It's you need to seek help, and also Ashley's point. You need to seek help from people who are not like you, who bring a different perspective. One of the nicest things, though, was ophthalmology is such a fraternal specialty. There are so many terrifically smart people who are freely willing to give their advice and give you input, and uh, so I have to say that helped me calibrate our ideas along the way tremendously. Talk to people like David Chang and Vance Thompson and just countless others who know this business, who know what clinicians need, and have seen enough ideas that they know which ones are likely to succeed and which ones aren't.
If you're going to do something that's going to require, FDA approval, and often a quality regulatory consultant can be valuable. And I just point out quickly, there is something called iCelerator, and there's an iCelerator meeting at ASCRS and another at the American Academy of Ophthalmology. And for the budding entrepreneur, it's a great place to go and learn and to network. And then Orange County is one of the meccas for ophthalmology entrepreneurship, and all of California, but Orange County especially. There's a group there called Octane, and they have a meeting every spring as well. And so I've often encouraged young entrepreneurs, to go to those meetings and basically just network. Does anybody else have any other valuable places they've found to go and network for
Yeah, let
for
me let
learning?
me add. So you mentioned Octane. I completely agree. The OTF meeting that is great. They also have a service that they offer not just to Orange County companies, but outside of Orange County. It's called Launchpad, and they really help the entrepreneur to refine your pitch deck. Your 10 slides that are going to tell an investor why they should invest in your company. And I found that process really valuable because the Launchpad ends with when your deck is ready, you go and you present it before a group of diverse industry people, not just eye care at all, and they give feedback, and it really prepares you to sell your idea at every level.
Any resources in particular, Ashley, that if I called you and said, that you would recommend to me?
Yeah, that's a good question. One thing I will say is that, even in all of us doing this podcast, there's a lot of ophthalmologist entrepreneurs. I think this is kind of a wonderful thing about the digital age is we all have an opportunity to really connect with each other. And I think, if anyone's listening to this podcast and has an idea and they're not sure where to start or are looking for some advice, even just reaching out to each other as colleagues, I think can be a really important asset because we can learn a lot from each other in terms of what we've each created. And so don't be afraid to ask people that you admire, people that have done something similar to what you envision yourself doing. We're such a wonderful specialty. I think everybody's very, very friendly with one another and collegial, and always happy to help out.
Anya, who would you encourage someone to talk to besides yourself?
Well, or you, or any of us. No, I'm with Ashley actually. And it's funny because this would be my fifth company, I guess. But I just had this idea actually at Ascaris last week, where everyone was, I mean, Ashley's right. A lot of people do have this entrepreneurial bug, and they have these budding ideas, if not, companies that they are part of, or even their loved ones. And I was actually talking to some people there at Ascaris. Pam Katz actually is one of them. And just saying, we actually need a database where we have services from all of each other's products and services, right? That we can call upon if we need something, because we just need to kind of know what each of us is working on, so that we can use that as a database where we can all learn from each other and trade notes and best practices and stuff like that. So I actually think that would be a really important thing for all of us to do. I mean, I'm glad to hear more about Ashley's line. I want to buy some now, and I want to, yeah, and I want to, tell my patients about it, because Ashley developed it and I trust her, and she does make it sexy. And so I would absolutely love to just know more about that, and same for you, John, and Dick, learning about the preservation for the corneas. I just think we all need to know more about each other, and have all this kind of in one place, and use each other as people to lean on.
Yeah, it comes down, I guess, to being confident and bold enough to ask for help. John, go ahead. So
I was just going to say it for you and me. It's too late to use Ashley's products. There's no hope
It's
doing
for
that.
eye care is for everyone.
that's right. We got to bring it home to our wives. Um, so you've got your friends and family capital. You brought your team together. You're making progress. You're iterating as you go along, and you've got something that you think is ready for prime time in quotes. One strategy is to try to find a strategic company to license it to. Another strategy is to find a strategic company to sell the whole company to, or the whole idea to. And a license, you just get royalties if it ever gets on the market. If you sell it, you get, someone buys it with the down payment and milestones, or you can build your own company. And so let's, just give us your own experiences about how you made the decision as to what you did when you were looking for, some type of an exit, or perhaps, Ashley and Rania, you got some companies you intend to just, run for life and have a family business. So John, let's start with you this time. So what how did you how did you find an exit for your company? Did you look at all these options, and what's the strengths and weaknesses of each? So
Yeah, so I mean, I think it's really important to start from the beginning with with the end in mind. And I knew that I did not want to continue running a software company for life, and so I built the company with the idea that we would exit probably with a company acquisition. And that was a pretty wide universe of potential acquirers, including EHR companies, including drug companies, device companies, and software companies, companies like Google and Microsoft. Um, and so you can't play to all of those possibilities at once. So personally, I targeted the audience that I had the best access to, which was in eye care. And while that's a limited number of acquirers, it was a very focused group that I thought could access, and the timing was right for a market need, and ultimately it proved successful. But the whole company had sort of been built with that in mind.
you built it with the plan to exit. So Uh, Ashley, what about you? Are you building a company that you'll still own in 20 years, or are you thinking you might have an exit, or just opportunistic? What's your strategy? So
Yeah, I'd love to continue to grow it at this stage because it's still so early. We're just finishing up our proof of concept, and the concept has been proven, which is really exciting. And I'm looking forward to launching more products coming up soon and expanding the offering. My goal eventually would be to have it kind of purchased or acquired by a larger cosmetics company that would really then have the breadth to be able to distribute product to the scale at which I can see this becoming as successful as I envision it. So that would be the goal. I'd always love to have a hand in it because, again, I think, there's so many influencers and celebrities that start skincare lines and makeup lines and aren't necessarily recommending the best ingredients for what we know people should be using in the eye area. So always having a hand in exactly what would be recommended that people are putting next to their eyes. I'd love to ensure that we're allowing people to do that safely.
yeah, and that can work. I mean, you can, in quotes, exit to a major strategic and continue to play a role in your company and on a go forward basis, or you can exit and then be a serial entrepreneur and do the next idea that you have. So, Rodney, you've done 5 companies, so I suspect that you're not part of all 5 still. And so, what have you done? So,
I've only done the 3 so far, but I'm working on number 4, and then number 5 just hit me at ascaris. And you do over the first
and there you
period.
go.
That's not really a company. It's more of like a spreadsheet. It's not a big deal, but yeah. So I had a little of all of them, like the Goldilocks method, I guess. The first one was acquired, but I was hired on, so an aqua hire, which I actually think is like the coolest proposition of all. And I think, John, you're kind of in that position, right? Where you're still helping to run your own company, but you've now gotten someone else to foot the bill, and add the resources to it, which is actually really nice. My second one, by definition, lifelong vision needed to be neutral. so that it could service everybody in the industry in a neutral way. And so that one I didn't want acquired by any one party. And it's, something that needed to be neutral. Then the third one, which is MetaMed, is it's still new and growing. And I'm kind of open to anything with that one. Certainly that's not going to be all I do. And it doesn't actually take that much time. So anyway, I have all three, under my belt. So
Well, when you're thinking about these exits, and I've done companies where I've completely gone away and been happy to go away, and I've done a few where I've continued to participate, and I even have one that sort of became a family business, and you can pass on even to another generation. So all those are possibilities. Yeah, but you need to think about it a little bit along the way as to not only what might be the exit, but also will there be an exit, because you're going to invest a lot of time and money, and it's nice that there will be an exit down the road somewhere if you want one. So,
and who should it be? I mean, one of the points I wanted to make actually is so with the first company when it was acquired, just like John, we had different offers, and it was, some wanted to buy it and kill it. Some wanted to buy it and grow it, and so those are things that you should think about when you are going through those types of situations. The other thing that I think was probably the most contentious of all, my brother was my co-founder there. I hired him on afterwards as a co-founder, and he really wanted to hold on to it and get more money than was being offered. And so it actually is important to sit back and think, okay, well, I could be greedy or I could just have a bird in the hand here. And that was, I know, one of the things that he and I went back and forth on this forever. And I won finally because with the research we were doing, telehealth was now sprouting up everywhere. And luckily we did, because that was before the pandemic hit. And then everybody and their mother had a telehealth company. So back in 2014, it was when things were just now starting to grow. And so it is important to kind of know the landscape that you're in, and to know the competitive analysis of what's around you and to see which different stages they're in. So you can make a really informed decision about whether you want to buy or hold and for how much.
so the good news is in our field of ophthalmology supports innovation. Not every field in medicine supports innovation as well as ophthalmology. There's still investors willing to invest in. And so for the young ophthalmic entrepreneur, there really is opportunity, and you've seen 4 examples of it here. And I think all of us would say, while it was challenging, it was rewarding. But let's just get a kind of a final message from everyone. Maybe what was the most painful learning that you had, and that you wouldn't want to do again, and also what inspires you to want to keep it going and do it again. Uh, so any painful learnings and inspirational messages. Who wants to start? Rhonda, you want to start?
Okay, painful message, definitely taking from friends and family. Never again, ever, would I ever want to be in that situation. And it's not because you don't believe in yourself, but sometimes just things don't go the way you want them to. And there's nothing worse. I mean, it's like dropping 10 nuclei in one day. It's the worst feeling in the world. But, it's one of the reasons you do it is also because you want to share your wealth with them, the wealth of the company and the innovation. And that's one of the reasons why, like, I was even tempted to do it in the first place, because I was so sure and wanted them to enjoy the benefits, right? So I wanted to bring them into that equation. I will never do that again. That was the most painful thing ever. But as far as inspiring messages go, what we did see is that we're having this conversation right now, and the industry is ready to collaborate and help each other. And I truly, deeply believe that this industry really does care about each other, and we all want to see each other do well. And so, working with our industry partners, I think, is super important. Working with our tech partners is super important. You cannot have a good product without contributions from every side: the industry partners, the tech partners, the business partners, the investors. and of course the clinician and your peers. And so it just really takes, it takes a multi-stakeholder approach to really create something magnificent.
So Ashley, what wouldn't you want to repeat if you had the chance to do it over again? Did you have any bumps in the road that are particularly memorable? And then you seem very inspired, and do you find this whole process inspiring, and why?
Oh yeah, definitely bumps. If people are telling you there's not bumps, they're not truly living the entrepreneur life. So I would say, my piece of advice is one: nobody's going to care about this as much as you do, and that's okay. So just set that expectation. You will be very passionate about it, and other people will not care as much. And then two, people don't really owe you anything. And so as much as you might think that you have a slam dunk idea and they should be investing or they should be purchasing your product or supporting it or doing this or that, at the end of the day, people are going to do what they want, and not everybody that you envision that's going to strongly support you will. But being able, I think, to really rely on yourself to have that kind of motivation to continue with what you know is a great idea. The moment you're kind of coming down on thinking that, I'm at the last of what I can kind of do for where my company is, just know that you're going to hit that turning point where things are going to start to turn up. And so if you can really persist and you're in your confidence of yourself and what you've built so far, I think you'll continue to do great things. And you'll always be surprised at what support will come forward next. And it's going to be in ways that you didn't anticipate. And it might even be a bigger and better idea than you ever thought it could be.
Yeah, perseverance and persistence. And you're right,
Mhm.
people do come out of the woodwork kind of just at the right time sometimes to help you
It's so
unexpectedly.
true. It's
So,
so true. And it's no one it's not who you thought it would be. It's somebody else, or it's some random connection from years before that happened to see something on LinkedIn that you post that inspired them. And so again, it's so funny how the universe works to bring these opportunities together, but having that faith is really what's going to keep you going.
so John, any bumps in the road for you along the way, and messages that you're still inspired to do more entrepreneurship?
Those are those are great messages from Rania and Ashley for sure. About persistence, that's absolutely number one. I think it's really important to understand critically what value your customer is going to derive from what you're offering. You need to understand that in a very practical way. While I started this by talking about allergy eye drops and understanding patients' perspectives, where we ended with MD Backline had nothing to do with that. It had to do with helping clinicians communicate with patients about premium lens implants. And we were able to show that they were able to sell more premium lens implants to patients because patients really want to buy these. They just don't understand them very well when they go into the process of cataract surgery. So if we were able to bridge that gap, we delivered something of great value. So that's the first message is be willing to pivot when you can deliver more value to your customer. And then the last thing, and I guess inspiring, is that when you assemble the right team, when you have the right people together, um, and you can get out of their way, and that's a really important skill for an entrepreneur is to sometimes get out of the way. Uh, it's just impressive. It's and inspiring how your idea will succeed under the guidance of people who kind of know what they're doing, are motivated, and have sometimes different ideas from your own. So we were as much buoyed by that as anything else that I did in the creation of the company.
Yeah, my advice always when my fellows or young entrepreneurs ask me is that probably the biggest bumps in my road is that it took more time and cost more money than I ever believed that it would, and so when we try to have a balanced life, if you're really going to be an entrepreneur, that entrepreneurial spirit can sometimes take you out of balance a little bit, and yeah, you can try to guard against it, but realize that if you go down this journey, while it's very rewarding, that you do have to make a time commitment and a financial commitment, and if you aren't willing to do that, don't do it. Would be my advice. But I would also say it's very inspiring to both have some successful products in the field, but also very inspiring to mentor others and help them have successful products in the field. And I think you heard that from everyone, is that there is a passionate network of people in eye care that are out there that are passionate about innovation and willing to be supportive. And I think that's one of the wonderful things about our field. So this is fun. I learned a lot. That concludes another episode of CRST, the podcast. We hope you enjoyed hearing from our guests as they shared their experiences and insights on entrepreneurship and ophthalmology. Their stories remind us that innovation and progress in patient care are driven by those who are willing to take risks and think outside the box. Ashley, Rania, John, thank you all for joining me today and sharing your perspectives, and thank you all for tuning in. Be sure to check out more stories of physician entrepreneurial journeys in the May issue of CRST, and stay tuned for more engaging discussions at the intersection of patient care and innovation in ophthalmology on CRST, the podcast.
For more shows like the one you just listened to, check out the podcast channel on itube.net.